I was 30, 31 when I was diagnosed. I really want to say thank you for the work that you do. Um,
Well,
yeah.
that's very gracious of you. It's been an amazing movement. It really has only existed for, gosh, at the most 30 years that we've had
Right.
this recognition that this is a group apart. And unfortunately, in that 30 years, while there's been a lot of progress, there's also been a lot of growth in the demographic and not in a good way. So
Right.
one thing that I deal with as a GI oncologist is colon cancer,
Right.
which we used to think of as a disease largely of senescence. And we used to set the screening age, 50 or older.
Right.
It's happening younger and younger people. And, the example I give, which is tragic and extremely well known, is I was sitting at home last summer watching Black Panther with my son on a Friday night. And
Yeah.
my cell phone starts blowing up, and it's all my friends, many of whom are non-medical, asking if I had known that Chadwick Boseman died of metastatic colon cancer. And I was just absolutely floored. I was watching the guy be a superhero on the screen. And he's a perfect example, actually, of, you can be young, you can be healthy, you can be incredibly fit, you can have resources, and you can still get cancer. And so one of the things we want to touch on is the false shame and blame that is placed on cancer patients. It's a disease that has actually long suffered from stigma. For decades, I think the New York Times actually had a ban. I think it was specifically on the phrase breast cancer. This was decades ago, but regardless, it goes to show you that we haven't entirely come away from that, and especially online, there's a lot of unfortunate finger pointing,
Right.
especially when someone young gets cancer. The assumption is, oh, you must have done something wrong, and
Right. Right.
far from it. It's usually not anything the patient did. It's some unfortunate combination of genetics and circumstance.